So let's take a look at the bones of the skull and the landmarks. When we talk about the skull, we actually have to divide it into two parts here. We have to divide it into the cranial bones. Those are the bones that are going to surround the cerebral cortex itself. And then the facial bones. Those are the bones that are going to make up what we would consider to be the face. So let's go ahead and move into the face now. The two most prominent bones that we'll see in the face will be the maxilla and the mandible. But we will also see things like the nasal bone, the vomer, and the zygomatic bone. We'll see another bone here in a second when we go and look at the inferior view of the skull. So let's take a look at some of the landmarks of importance here. We have the mental foramen, which is going to be an exit point for part of the facial nerve. We have the angle of the mandible and the ramus of the mandible. And then we have the mandibular condyle, which is going to be articulating with the temporal condyle and facet to form the temporal mandibular junction. On the maxilla, we have the infraorbital foramen, which is going to be an exit point for, once again, some of the trigeminal nerve. We have the vertical plates and concha within the nasal opening, coming from the vomer, maxilla, palatine, as well as the nasal and lacrimal bones. From the zygomatic bone, we will have the temporal process. Additionally, we will see all of the teeth for both the mandible as well as the maxilla, the maxillary teeth and mandibular teeth. The teeth will be sitting within the openings of the bones or the alveolus for each tooth. We'll get to the teeth and the dentition patterns when we talk about the anatomy of the digestive system. So let's look at the inferior view of the skull now. On the inferior view of the skull, on the maxilla, we will see the incisive foramen. And we will see the other bone that I was talking about that's going to be one of the bones of the face, and that is the palatine bone. The palatine bone will have part of that vertical plate that we saw with the vomer. We will see the temporal process of the zygomatic bone. Moving to the lateral view of the skull, looking at the facial bones, we will see the angle of the mandible, the ramus of the mandible, the mandibular condyle, the temporal process of the zygomatic bone, the mental foramen, and then we will see the mandibular teeth and alveoli, and maxillary teeth and alveoli.